Alex wears hearing aids. Alex is severely deaf. Sound has never been his main source of information. One day, Alex goes in for a routine appointment. Nothing urgent. Nothing wrong as far as he knows. The doctor takes a look inside his ears, pauses, and says, "Your ear canal is almost completely blocked with earwax." Alex is stunned. No pain, no warning alarm, nothing that screamed, something is wrong. So why didn't Alex notice? And that leads to the real question people are quietly curious about. Can severely deaf people actually tell if they have earwax? The answer is yes, just not too much through sound. Most hearing people notice earwax when the world starts to sound muffled, but for someone like Alex, hearing loss isn't the signal. Instead, the body becomes the signal. As earwax builds up, it physically changes the ear canal. It alters pressure, traps heat, and comes into contact with sensitive nerve endings. That can cause sensations like fullness, itching, warmth, or a blocked feeling, even when there's no pain at all. Looking back, Alex realizes he did notice something. His hearing aids felt tighter than usual. They were harder to insert. They caused mild irritation he brushed off as normal. For deaf and hard of hearing people who use hearing aids or cochlear implants, this is one of the biggest clues. These devices are designed to fit with precision. Even small amounts of wax can change how they sit, how pressure is distributed, and how comfortable they feel. Audiologists see this constantly. Earwax buildup is one of the most common reasons deaf patients come in for adjustments. Not because they can't hear, but because their ears feel different. There's also balance. The ear plays a role in spatial orientation. When wax accumulates, it can subtly affect balance, causing lightheadedness or a sense of being slightly off, especially during movement. And here's something most people don't realize. Earwax buildup is usually gradual. The body adapts. Small changes start to feel normal until someone actually looks inside the ear and sees how blocked it's become. That's why routine visual checks matter so much, especially for deaf and hard of hearing individuals. Wax is often discovered during regular maintenance visits, long before it becomes painful or dangerous. So deafness doesn't reduce awareness. It changes where awareness comes from. When sound isn't reliable, the brain becomes better at reading physical signals: pressure, fit, sensation, and balance. Now, how can anyone spot earwax buildup early? If you use hearing aids, pay attention to changes in comfort or fit. Notice new irritation, warmth, or pressure. If your device suddenly feels wrong, don't ignore it. If you don't use hearing aids, watch for a plugged or underwater sensation, especially in one ear. Persistent itching or warmth without pain is an early sign. If chewing or jaw movement causes pressure shifts, wax may be pressing inside the canal. And one important reminder for everyone: cotton swabs push wax deeper and increase blockage risk. Professional ear checks aren't overkill. They're preventative care. Alex didn't miss the signs because he was deaf. He missed them because earwax doesn't announce itself loudly. It shows up quietly through pressure, sensation, fit, and routine. If this answered a question you've always wondered about but never asked, subscribe and like, and I will see you in the next video.